roll?
Yeah.
All right. Director Pimentel?
Here.
Director Gallagher? Julie, Peterson? Here. And Maxwell Brandy? Here. And Jessica Dixon? Okay. We do have a quorum.
Oh, I'm sorry. Yes, she was hanging up flyover. There. Okay.
And
printing some stuff up.
Do we have any changes to the agenda? Or two on consent, two on discussion? Any comments from committee members? Seeing none, we can move on to the consent agenda. Under the consent are minutes from our April 24th meeting and investment policy for the Paro Valley Healthcare District Hospital Corporation.
Director Pimentel, real quick, we do have one audience member.
So under the consent for those items, we have a motion to approve. We have a second. Any public comment?
Do not see any hands raised online. Oh, I do see a hand raised online. Is anyone online? Mr. Norton, if you'd like to address the committee?
Hello. Yeah, can you see me? Can you hear me? Can you hear me and see me? All right. I guess this sort of meeting format doesn't allow my video to come through.
No, it does not.
Okay. There's a board meeting tomorrow. Will there be another opportunity for me to address the board tomorrow?
Yes, there will.
Okay. Well, then I will keep it brief, but my comments are about a soda tax in Watsonville. I believe that many of the people in the hospital district may have worked on this initiative in the past to bring a soda tax to Watsonville, and then the soda industry put up some roadblocks, and those roadblocks are now gone. So it's likely that Santa Cruz could pass a soda tax next month, and it would go on the ballot in November of this year. So I'm talking to you today to urge you humbly to talk to the city council members of Watsonville and ask them to pass a soda tax this year. As you may already know, soda causes various health problems such as type 2 diabetes, heart disease, cancer, gout, non-alcoholic fatty liver disease, and more. And sugar has been shown to be addictive, stimulating the parts of the brain that are also activated when people use drugs such as cocaine and heroin. Ultra-processed foods such as soda have even been shown to impair children's learning development. And so more than half of Hispanics are predicted to develop type 2 diabetes in this generation. So if a city like Watsonville has 50,000 or so people, if we wait 2 years, my question for you is how many more people are going to develop one of these conditions such as type 2 diabetes, and how many of their family members are going to suffer as a result of being around those problems, which I think you probably would agree that a condition like type 2 diabetes is completely preventable. And it's believed that the consumption of soda is one of the main drivers for type 2 diabetes. So in conclusion, I ask that you please contact the city council members of Watsonville as soon as possible, because we need to get this on the ballot by the end of June. It needs to be passed by the city council by the end of June, rather. And also, if you have any soda or ultra-processed foods that are being sold in your hospital, I ask that you please reconsider those policies that allow that to happen. That's it for me. Thank you.
Thank you, Mr. Norton. As mentioned, you do have the opportunity to address the board in person or virtually tomorrow evening as well.
Thank you.
like me to, take roll for the passing of number 1?
Thank you, yes.
Thanks, back to that. Director Pimentel,
Yes.
Director Gallagher, Matt Covranges,
Yes.
Jessica Dixon,
Yes.
and Julie Peterson.
Yes.
Pause when we're, the members, introductions of, yes, or me today.
I'm Margaret Morgan, I'm the interim HR director.
I'm Phyllis Stark, I'm the new.
You both, Margaret, so appreciate having you here.
Marcus Pimentel, our finance committee chair and board member.
Discussion items, so item number 3 is the financial performance for April 2024. Julie.
Go ahead. Hi, Gary. Just a moment, Julie, and I'll put a presentation up for you.
All right, I'm ready. Let's do that. Okay, so, we had a good month in April. As has been the story in the past, everything tends to ride on net revenue. We did have, a strong net revenue month, in April. And, you know, really, as we go back and look, you know, we're always kind of diving in, trying to figure out, any kind of shift. There was a couple of main items here that helped our net revenue. We actually had grant revenue of about $180,000. We were a little bit unfavorable in the other things that we had put into other revenues, so we only came out with 117 favorability there. But there's $180,000 that we were able to put towards the anesthesia machines. That was a grant that June Ponce and our philanthropy group was able to pull together. And then, as we've talked about before, our clock revenue is actually going to be favorable to budget all year long, although our clock expense will be unfavorable to budget, but the revenue increase exceeds the expense. So, you know, when you take those two things off, our actually on a year-to-date basis, so that's the number I have in my head, we have about a $425,000 favorability. And as I look at really what seems to be contributing, we're always looking for some better ways to analyze it. We are seeing some slight improvements in payer mix, especially the last couple months. We've seen a ton more outpatient surgeries this year than we've planned for. This month, we did see an increase in our inpatient surgeries. ED volume has been growing month over month. And I took a look just at where we made our most significant charge master increases, just as a starting point. And it was ED, room and board rates, surgeries, observation, which is another thing where we've been swinging. So that's part of the story. Of course, the rest of the story is in the payer mix, because you're really only going to get that pickup from the commercial, but we are seeing a slight improvement. So we're going to kind of try to figure out if there's a way we can get a little bit more specific in this. But it did give me a little bit better comfort level as to why I'm having better net revenue months than I had planned on. I also just took a look at what was sitting in the AR now this month. And you can take a look both from a payer mix perspective and a hospital service line perspective. And once you know it, I mean, basically 89% of our AR is ER, room and board, labor and delivery. That was another one I forgot to mention. Observation cases. So it's kind of the same storyline. The hospital service line, where we're seeing our growth, does align with where we've made our most significant charge master increases. So now we can just get a little more touch on how the evaluate, or how the, you don't always get a big pickup from your government payers, but just how that's coming together. Let's go back. Okay, so yeah, so I really just pause here for a minute to say, you know, the month to date, we had $925,000 worth of EBITDA. year-to-date, we're at 2 million, and so about 850,000 favorable to budget. Okay, let's go on to the next. So here's admissions. It was a fairly good month, just under 9 admissions a day. So we're doing okay there, considering. I think the next slide will show my. Go ahead. Anything? Okay, it's coming. Deliveries in line 65. That's kind of right around our average delivery month. So here you can't see the small marks too much, but up on the top is your average daily census. And we had a good month in March, so we did come down slightly. We're at about 32. 31, maybe I misread earlier. So 31. I think this month I've seen a few days that are higher, and I'm going to show you a slide that's going to come up in a little bit that'll show some of the volatility in the daily census. Still a very tight length of stay. Our acuity has been pretty low, especially not having as many inpatient surgeries, and I think that's that, as well as the work we've talked about before, that just case management does to control length of stay and control the inpatient versus the admission is really what we're seeing here. It's pretty consistent. Next slide. Here's what inpatient surgeries. So, we've got 10 more surgeries this month. Not a big, it was actually slightly down in just our acute CMI, which would include more than surgical cases. But at least a little bit of uptick because we had been very low in our surgeries for the last couple months on the inpatient side. So here's the slide I was alluding to. This is every day of April, the daily census, and the different colored bars are the financial class. So the orange at the bottom is your Medicare and Medicare Advantage. The yellowish is your Medi-Cal and Managed Medi-Cal, which is the Alliance. The green, where I have the numbers, is commercial, and then the little reddish color at the top is self-pay. So you can see there's quite a variety. We have days where we're down at 25 patients and days where we were up at about 43 patients, and a lot of things in the 30s. And if you could see the numbers, you can also see some days we've got 2 or 3 commercial patients, and other days we have 5 or 6. And so there's the volatility makes it challenging for staffing because of staffing ratios and just planning and core staffing and how nimble you can be. And then the payer mix shift is just really makes a huge difference on our net revenue. Okay, next slide. Outpatient visits, green is the ER on top, and the yellow is the non-ER outpatient visits. Same story here. The ER especially, we were at 81.5 per day in January. We're up to 94.5 per day in April. Same thing, the non-ER visits just kind of keeps growing. Good for us from the perspective of volume is good and helpful, but as we've talked before, outpatient volume doesn't pay as well as here's surgeries, kind of inpatient versus outpatient. The blue at the bottom is the outpatient surgeries. We had 129 this month, so another very strong month. And we had 24 robot-assisted cases, so that, was back up very high. We've gotten there, and we're staying there in the higher numbers. Very pleased with that. Here's payer mix. Good news. The blue at the top is the commercial. So last month we were at 14.3. This month we're up to 16% on the inpatient. And that, the rest of the movement is fairly acceptable. I mean, when you get a little bit more commercial, everything else has to go down a little. Next slide. outpatient also improved on the commercial mix from 23 to 24%. And, you know, the Alliance is, still up there pretty high at almost 47% in our, mostly, it's all outpatient visits, but a lot of that is in the emergency. That is it. So that's how April turned out, you know, a strong month for us financially, and, helped us kind of get back on track after a tough March.
For, supplies ahead of budget on cost. Yeah, we're buying more at the beginning now than.
Well, some of it could definitely be volume related, you know, due to the, especially the outpatient surgeries. There's still a lot of work with our implementation of the group purchasing organization, Vizient. You know, a lot of work in terms of learning what the opportunities are to make sure that we're in the right tiers, making those contract conversions. And a little bit of that happens every day. It's kind of, a lot of it's as it comes up, it gets addressed. But we're also trying to get ahead of it by working with the Vizient rep, Kathy from Supplies, and Chad, you know, working with them, what reports are available to us on other opportunities, how our compliance to contracts is, just what our volume and usage is compared to prior periods. And some of that had to wait for them to be able to get prior period data loaded into the system so that they could do comparisons for us. So I think we're in that any day. I do think we're going to be over budget. Some of it's going to be volume and just cost of services. I haven't given up yet, and we're still trying to figure out if there's really a there with this whole sales tax exemption. You know, we've kind of gotten some conflicting stories, and it seems to be a tough thing to kind of find the right answer and find the right resources to give us an answer. And I will tell you that there was probably on an annual basis $500,000 or $600,000 worth of savings baked into supplies on this whole sales tax exemption. So it's kind of hanging out there. Any other questions?
No action required. Any final comments from committee members? Any comments from the public?
No hands raised online.
Move on to item number 4, Far Valley Healthcare District Hospital Corporation Consolidated Provider Relief Audit Engagement.
Yeah, basically, because we got provider relief funds in the beginning of 2023, we are subject to the single-use audit, and so we have engaged our auditors, the same ones that do the hospital audits, JWT and Associates, so the same ones you've seen for the district and the consolidated financial audits, and they'll come in and they'll test for, you know, that we reported correctly, that we followed policies and procedures on internal controls. They'll help with the reporting that has to be submitted, just to say that basically we did comply with all the federal regulations. And so we went ahead and signed the engagement letter. This audit has to be done by September 30th, I think. Having done one of these up when I was in Seattle, and it was painful to the last minute, we were trying to get as much of a head start on it as we could. Especially because we have people here who weren't here during the period of actual spending of these funds.
The common JWT is in our current auditor, anyway, they're very familiar with us. That'll make their single audit much more efficient. items before the board for consideration. Tomorrow's board meeting, any comments from the committee? Public members?
No hands raised on mine.
With that, here at adjourn. Pause for 3 awkward seconds. Awkward. And we are adjourned. Thank you all.
Thank you.